But really, a lot of the time, it's reassuring that actually it's highlighting all the things that they're doing so well and reassuring that every single parent goes through this and there is no perfect parent.
Hi, I'm Crystal Lewis, Professor of Education.
And I'm Amy Ketchum, Pediatric Occupational Therapist.
Welcome to Plant the Seed of Learning, the podcast where we merge education and medical models to bring you science-based, practical insight on all things early childhood.
Whether you're a parent, a teacher, a therapist, or a policymaker, we're here to help you support children from the start.
Today, we are so excited to have Kate Beckwith with us. She's a fully qualified psychodynamic psychotherapist and a member of the BACP with experience of working with a range of children and young people. As an arts education specialist, Kate taught in mainstream schools, colleges, and universities, pupil referral units, youth offending teams, and specialist groups, including groups with Asperger's syndrome and drug and substance misuse groups. Kate's network is extensive and includes primary and secondary schools, colleges, universities, counselors and therapists, academics, professors, educational psychologists, educational specialists, play therapists, and the list continues to go on. Kate works in educational settings and at her private practice, offering one-to-one counseling and group counseling and consultations. In this episode, we will learn about a revolutionary therapeutic practice. Kate's unique approach to psychodynamic and psychoanalytic therapy provides children with access to the outdoors, nature, animals, art, and play. Freedom of child is the key, and clients choose whether they go indoors or out. She shares practical suggestions with us, and we will learn about this rare practice, including the benefits of movement and physical activity to help us process our emotions. Being outdoors in nature triggers a dopamine release, which we love, that is often neglected. Join us as we consider ways to incorporate what is good for our children, letting them be curious about our world.
Wow, what a mouthful. We are
Wow.
so excited to have you as a pediatric occupational therapist. I love the experiential play aspect. So I'm sure we're going to all learn so much today, and this is such a treat for our listeners. So let's start with a fact or fiction. Therapy that works only takes place in traditional settings. Is this fact or fiction? What do you think, Crystal?
This is fiction.
Absolutely fiction. Therapy with children in non-traditional settings moves beyond the classic office, using environments like schools, homes, parks, or even nature to offer play-based, art-based, or even animal-assisted therapies, making mental health support more accessible and relevant by meeting kids where they are and leveraging their natural ways of communicating, such as through play, art, or movement to address trauma, anxiety, behavioral issues, and developmental challenges, which often integrates family and school systems for fully holistic support. So that is a perfect segue to bring Kate to our conversation today. Welcome, Kate.
Thank you so much. Thank you so much for having me here. It's really such an honor. It's really lovely. Thank you.
We've done so much talking already, Kate. Can you share with us your background and
Of
how you support
course.
children?
So, I mean, you've summed it up so beautifully. I was sitting here thinking, oh God, I've done all that stuff. That's great. But yes, my background is in arts education. I worked for various charities, filmmaking charities, and I got to play for years and years and years. I got to play and play and play with children and their families and really see that kind of interaction and dynamic and what came out through the communication and the play. So yeah, really interested in that that element of it, and I retrained to be a psychodynamic psychotherapist, which is such an honor and a privilege to be able to go through that training process. Really looking at very kind of analytical, deep rooted kind of theory-based stuff, and then taking it out into more clinical environments, and I work with schools. And yeah, as I was during that process, I guess I just gathered all of this experience and all of this knowledge and understanding that I had from my past and brought it to what I was doing now, and realized that, you know, as a new therapist, you don't just leave all of that behind you. You kind of draw upon all of your experience. And yeah, I just started embedding what I knew, which is the arts, very much freedom of choice, and that access to outdoors and nature, which is a huge part of me and my background. So yeah.
I love your connection to your experience, because I think as an educator, when I first started teaching, I was doing things now that I cringe about now. So as we learn from our experiences, I think we get better no matter what facet of work we're in. So I agree.
Absolutely. And we can be so drawn by the, you know, what you're taught, and you have to apply what you're taught, that you can forget about all of that other knowledge that you have, whether it be parenting or whatever it is. It's so easy to just kind of go down that quite narrow road, isn't it? And forget about all of this knowledge that you have. Yeah.
Certainly. And as parents, I think once we have children, we also develop a broader understanding of young children and the things they go through internally. And I'm sure you are so well versed at this.
This is, yeah, it's a really interesting part of my training. So I had a child as I went into the training, and then also I was pregnant during the training and had my second child. So it's very interesting, those two different experiences, as you kind of learn and progress about, you know, what those interactions mean. And there's lots of personal work that's done as a therapist. You have to kind of, I kind of describe it as being pulled apart and then put back together again, really. So yeah, it's quite a process.
Interesting. So, Kate, I'm very interested. So, I practice in the neonatal intensive care unit with the tiniest of babies, and observation and observing the babies is such a critical part of occupational therapy, you know, in that type of setting. I'm curious about you having your credentials. You note that you are infant observation trained. Can you tell us a little bit more about this facet of your work?
So the infant observation training was something that I applied to do and was accepted onto the training course after I qualified as a psychodynamic psychotherapist, a child specialist. So honestly, that was one of the best things that I could have done, because it really was just a fantastic opportunity, and again, such an honor to be able to spend the time to really sit and wait and observe and learn through that process, because as a parent, we don't get to do that. And there's no real other circumstance that you're just sitting and watching and looking, and you get to see in such minutiae detail the interactions that are going on between the baby in this, you know, pre-verbal stage, where so much is embedded, and things can become crystallized quite early. So yeah, it was such an honor to be able to see that, you know, the tiny cues that they give, and the kind of complex interactions, and the family dynamics, and how that all kind of begins to develop very, very early. So yeah, I'm really fascinated by this kind of early work, and your work must be so rewarding to be working in that neonatal field. Like, it's, yeah.
Yeah, I love it. But yeah, you make such great points. And I know so often I wish I could spend more time just observing. It's fascinating to watch a newborn baby, right? And how they interact, how they look at mom or dad, or turn their head to a voice that's, you know, they hear, and show that awareness of their auditory environment or visual environment. It can be really fascinating. And I love that you spend the time doing that. I feel like nurses and therapists or parents sometimes are just thinking, what are you doing? Why aren't you putting your hands on the baby yet? But that time to spend to really just observe is critical.
It
Yeah.
really is. And to see them develop over the weeks and months as well, and such an honor to see that process take place, and to get that very deep kind of understanding of what might be going on there in the way that the parents relating to the baby. And it's very, very interesting.
Yes.
Yeah.
That's fascinating, especially today when cell phones are really a competition between our time with baby and our time that we're drawn to our cell phones, because all we think about is, oh, I have to delete emails? I need to keep up with work. We're getting these notifications. So I think it's really important that parents take a deep breath when they have those babies and they sit back and they really observe their babies, because we can learn so much from our babies just in the quiet times.
Yeah.
Like you say, it's getting harder and harder, isn't it, to do that with so much pull, all of these different distractions and all of this pull, and this sense that you have other things to do, or you should be doing other things. And just to reiterate that you are doing the thing. This is your job. You are allowed to do it. You know, this is the most important job in the world. And you know, all of this time that might feel like doing nothing is doing everything. You are doing everything.
Amen.
Yeah.
You say that so beautifully. I
Mhm.
hope every parent listens to that and takes it to heart.
Yes.
Speaking of beauty, can you tell us about your practice, Kate's Garden, and how you're using nature, animals, my favorite thing in the world, and art within your therapy?
Thank you so much. Yes, so I have this is my indoor part of the setting, part of my practice. But children can go outside. They can do whatever they want. So that it's very much child-led. It's very much dependent on their interests and on their mood at the time, because we change, don't we? In every kind of moment of the day, we might change. It might be part of our personality. It might be part of what we're going through at the time. But yeah, they can go out into the garden. I've got a woodland setting. It's very safe. It's got this fence that goes all the way around, and inside we've got 2.5 acres, beautiful trees. They can jump up and down on the trampoline. They can go and interact with the ponies. Got pigs, guinea pigs, goats, chickens, a little pond, a tree house, swings. So it's very much, you know, they can choose where they go and what they do, and it can help them to feel safe and regulated, and it puts them at ease much more quickly, and then it allows them to begin relating to the therapist, me, in a way which is much, much more conducive to the work. And it speeds things up and it helps them feel safer. And of course, you know, all the good things that I talk about in my TED talk, the oxytocin, the serotonin, endorphins, all of these really important chemicals that we have in our body can be triggered by this natural environment. And of course, I've got my arts background, so that feeds into it. So there's the kind of art therapy there, but it's very much all of these things are the child's choice. So I don't lean upon any of them heavily. It really depends on what they want to do. And it's this freedom of choice and this autonomy in this world, as you say, where, you know, there's so many different poles with technology, and with the education system is so rigid. So it's really this opportunity for them to make their own choices and lead their own way, and through that, then the work kind of develops. So yeah.
I really like the way you're discussing choice, because as a classroom teacher, and I teach courses about education all the time now at the university, but choice is so big in classrooms today, and honoring children's desire to have choice in their learning is so important. And then you also mentioned the feeling of calm. And when children feel safe, we know they learn better. So I think about the calming corners found in a lot of classrooms. So in classroom settings, teachers will set up these calm corners. And if if a child needs to, they can go to that corner to self-regulate.
That's so wonderful. That's exactly what they need. And that's basically this, but on a smaller scale. So, you're tapping right into that. Unfortunately, not all schools can do that. I think, around the world there are different kind of approaches. And I think maybe the UK has got some maybe some catching up to do, or maybe some going backwards a little bit into how we used to do things, because things became a bit more structured, whereas there was much more kind of choice and free play. So yeah.
The word you used that resonated most with me is autonomy. Giving children that autonomy to make them feel like they have some control over their environment. And I think that really boosts their self-esteem and their level of independence. And I think that's so important when you're forming a rapport and a connection with that child, that you're showing them that you respect them by, allowing them to, have some thoughts about how they're going to portray themselves and in what environment they're going to do that. So that's great. I love that.
That's absolutely spot on. Yeah.
Yeah. You address many areas with children, including ADHD and autism. So do you find diagnoses of these conditions are on the rise in the UK, as we are seeing here in the United States? And how does your work support these areas?
Absolutely. We've got it's definitely on the increase, which is of course to do with awareness. It's always kind of been there, but also, the environmental impacts of the fast pace of the world today. So yes, it's tricky here in the UK. There are long waits for things.
Okay.
But I hear, as a therapist, I hear so many schools getting it so right, and being incredibly supportive and incredibly switched on to what children need. And like you said about choice, them being able to get up, and no matter who they are, whether they have a diagnosis, a formal diagnosis or not, that they get to choose whether they put the headphones on or make these other kind of small choices in the classroom. But yes, it is difficult, and that's not the story for a lot of people. A lot of people are taking their children out of education and doing home education. We're seeing a lot of that over here. So yeah, a big part of my job has become, I do become a bit of a beacon, I think, for people who have, I didn't realize at the time when I was setting up my private practice, I didn't realize at the time what I was doing. I don't think. I have ADHD, and I didn't realize it before I set up my private practice in the way that I did. So it's clearly something that people with ADHD and autism are very much drawn to, this freedom of choice and the way that I approach things. So yeah, I went through my whole of my art degree exploring what was essentially this struggle with all of this information coming towards me too fast. I went through all of that. I did all of my training, and yeah, I didn't realize until a couple of years after I set up my private practice. And it was actually working with children and recognizing in them things that are in myself.
Wow.
Yeah, so I do feel like I have a good understanding of what actually we need. It's just a case of, I'd love to be able to translate that, to be able to help more people to understand the environments that children need in order to feel safe, like you say, and connected, and to grow in the most supportive way.
I love that you mentioned environments, because environment is so crucial, whether it's the classroom environment, the home environment, the community environment, all that matters for our children. And you also do work to support parents and caregivers of children. And we know that parents and caregivers always want what's best for their children. They try their best. Can you tell us how you support them in understanding their children?
Thank you. I love working with parents. It's one of the highlights of my job, because the children that I work with are referred by their parents. So, and that's where the freedom of choice comes in again, is because often it's not a choice that the child's made. But already we have parents who have noticed something and they are ready to get that support and do what they can. So how I work is often parallel parent work, depending on the child, depending on what they need. I will offer maybe weekly, maybe once a month, parallel parent work. So we really get into looking at what is going on a bit of a micro level, get the magnifying glass out and just have a really good look at what's gone on. And then I can help them with tips and support and really just thinking about what the child is communicating, really, and how to understand and support them better. Because, like you say, the parents are under lots of pressure and they just want the best, the very best for their children. And sometimes we can get ourselves caught in a bit of a rut of putting too much pressure on ourselves and getting stuck in this sense of guilt, which is the most unhelpful of all of our emotions, this kind of guilt. But it's understandable, but it's kind of moving from that to something which is more constructive and more helpful for all of you. So yes, much more about what the message is behind the behavior and helping parents to understand what that might be.
How do you get parents past that guilt? Like how do you help them work through that?
That's really interesting. It's on a case by case basis. I guess it's quite hard to think in an abstract way about that, but I suppose there's always
See how it depends on the case.
there are some common threads, I guess, which would be I don't know. It's hard to kind of, I guess it's hard to just pin that one down. I'm struggling to pin that one down, but really a lot of the time it's reassuring that actually it's highlighting all the things that they're doing so well. Yes. And reassuring that every single parent goes through this and there is no perfect parent. I think once you hear that from a therapist, and that is the most truthful thing that I could say to a parent, is that there is no perfect parent. You know, when we talk about the good enough parent beyond's good enough parent, and that's so important, I think, for parents to hear. So that's a really big part of this guilt, and also to talk with them about this rupture and repair, which is one of the most important things that we can do as parents. That when we get things wrong, it's not that we don't get things wrong, we get things wrong all of the time, but it's actually this repair that comes afterwards, and really supporting them how to do that and how to feel safe in their own bodies, that actually to repair is a safe thing for them to do, because often we weren't taught how to do that by our own parents. So
there's a lot of a good point. Yes.
The repair
and repair part, and also not to compare yourself to other parents that you know. I remember when I had young children and I would be in playgroup settings, and you do compare your children to other children, and you compare yourself to other parents, and that's not necessary because we're all doing the best we can do.
It's so hard, especially with social media, because this is what we see. We see this beautiful facade, and it's not like that at all. And it's just reminding yourself that it's not actually true. It's not like that. And I think that's why sometimes group work for parents is very helpful, because you hear these other stories. You actually get to hear the nitty gritty and what goes on behind closed doors, rather than just this facade, because like you say, it's so easy to compare, isn't it?
It is
very validating. As a mom, I find that very validating. So thank you, Kate. Thanks for sharing that.
My pleasure.
In your TED Talk, you share how technology has caused a shift in the amount of play and access to nature. So what can we do to adapt to the evolving needs of children?
I think we need a bit of an overhaul. I'm going to be really honest about that. I think this is no small ask. I don't think there are any quick fixes. I think that it is an overhaul. I think, not to be too dramatic, but I think we are getting it wrong on lots of levels about what our focus is on in the education system, and the style of learning that seems to be coming through, which is still, I don't know why, I don't understand how, still this Victorian model, still this kind of facts-based learning rather than this investigative and exploratory and curious and making mistakes model, which is play, essentially, isn't it? So yeah, I think it needs a huge overhaul. I'm going to be brave and say I think it probably needs razing to the ground and starting again. That's quite extreme, but that, I'm from a whole family of teachers, and I didn't go into the education system because I could see that there were so many things wrong with it and so many frustrations. And this isn't about teachers doing a bad job. This is about allowing teachers to do what they know that they want to do, what they need, because they are the experts. They are the people that see what the children need. And I often speak with teachers and they're so frustrated that they're not listened to. So we need to listen to teachers. I think is one of the first and foremost things that we need to do. But yes, really looking at this environment and allowing this autonomy and allowing children to make choices and show us and be co-collaborators and little explorers and detectives.
I think that's great because we do need to listen to our teachers, but we also need to support them. And I think supporting them with the notion that play is learning in the classroom setting, and play is how children learn best in the younger years. There's so much that develops from a play-based, purposeful play type setting with, teacher guiding through the content, but allowing them that discovery and creativity and the choice.
It's almost back to that observing, isn't it? And allowing that to be the work. Like we were talking about earlier, Amy, when you were saying how, parents don't feel like they're allowed to just be there and watch their children. And actually it's such an honor and a privilege to be able to watch. I think it's to be able to really empower teachers to go, you are doing your job when you're doing that. To give them the confidence to have that and take that back would be fantastic. I'd love to be able to see that. Yeah.
So what is one thing or one piece of advice you would provide our listeners as we come to the conclusion of our time together?
Oh, what do you think? I don't know, which one resonated with you guys? I think that kind of rupture and repair, I think, was quite a big one that kind of resonated. I think that's really important. We talk about connection before correction, not trying to fix something in real time, but just making that connection, really, really kind of getting down on their level and getting that kind of contact back and co-regulating before you actually move into that learning from what happened type scenario. So connection before correction and moving away from that sense of perfection, which is so unhelpful for all of us. Yeah.
Absolutely.
Thank you so much for your advice and your thoughtful consideration of all things children and how children develop best.
Yeah. Those are some great tips that I think our listeners could put into action today, immediately with the children their own children, or if they're teachers or therapists. The piece about connection before correction, I love that. And that we've talked in previous podcasts about co-regulation, which is, of kind of a similar concept of really thinking about what we bring to that relationship with a child. So I love that. That's really beautiful. Thank you so much for being with us today. We have learned so much and we really appreciate your time.
My absolute pleasure. Thank you so much for having me. It's lovely.